Ryan joins us today to discuss the keys to case acceptance.
Ooh, I like that. Can we just leave it with that voice? I'll hum over it and you talk. Like a Viking noise. Home.
On this episode, Ryan and I discuss if being old increases your case acceptance, or are you just old?
Yeah, that's the one. That's the one.
Welcome to The Dentist Show. Let's jump right in.
Okay, welcome to The Dentist Show.
The Dentist Show.
We're back.
We're back.
We're back.
Back with another podcast.
Dude, it looks like I'm representing University of Texas right now.
Yeah, and I'm wearing, it's like
Burnt orange.
we're totally Halloweening it up over here.
Well,
What's the topic of this podcast, sir?
Okay, so is it case acceptance? Is it better to look old
Okay.
or to be funny or to like just build relationships with the patient? Because when I was 30, I thought, because I'm more of a glass half full guy, I'm like, well, that's why I'm so good at case acceptance, because I look old. So is that like, so what would you say if you're like a patient, a doctor struggling and they look young? I had a doctor like this, like she was young. She went to Pacific and she just was young and she looked young, and she was like 28, but she probably looked like she was 22.
Yeah.
So do you think that's a deterrent to patients, or what's your thoughts?
Well, I mean, first of all, I think I'd like to establish that I'm a triple threat. I am old looking, funny, and build good relationships with patients.
So that's all three.
So I think that might be, because I think actually, all jokes aside, I think that's what you bring to the table, is you are like a triple threat.
Triple threat.
Yeah.
They like the bald guys.
They got to watch out for that.
They call me Vin Diesel.
You're old enough that all patients will trust you, young enough that the old ladies still think you're cute.
Yes, that is the secret to success. A little flirtatious with the old 75-year-olds.
Yep, they like us.
Widows. Yeah.
They like us a lot.
They do.
And to get back to your question, I do think that it is hard for patients that are older to trust the 20-something dentist.
Which makes sense.
Yeah, I mean, there's not. It's not without merit.
Yeah.
Right? They are a younger dentist.
Yeah.
That doesn't mean they're not competent.
Yeah, I think I get it too, because it's so hard. Like, how do patients judge how good a doctor you are? And like for me, like if I'm going to a back surgeon and you've been out of school for a year, I'm going to go, oh man. If you've been out of school for 15 years, there's like no doubt, like, oh yeah, he's got this. Yeah. And if he's been out of school for 40 plus years, it's like, let me see how shaky his hands are, you know.
or what technique is he using these days?
Yeah. Because sometimes they're like amazing, and then sometimes they should be retired. We have dentists. I have a dentist now that's a little older, and the guy's probably one of the best practitioners out of all the dentists we have. Yeah. And I've had an older dentist that should have retired 5 years ago.
Yeah.
And I don't know.
Let's hear it.
Let's hear it. But the assistant and I don't know if my hygienist listens to this, that used to work with us. But the assistant, he would from time to time start drilling the wrong tooth, and so the assistant would have to move his arm like a little further back. Like she was telling me that, I'm like, oh no, and then. I don't know why this is coming up.
Yeah, this is deep.
One day I get a text from the office manager saying, "Hey, the team wants to know what to do. They have a question for you. They don't know what to do." And I go like, "All right." And it's just, well, I don't know if I can say this without laughing, but this doctor, he smells like pancakes and syrup every morning. And I was like, she just left a text at that, and I was like, dude likes pancakes and syrup. And so I didn't say anything, and then a few seconds go by, and I know what you're thinking, and he does not eat pancakes and syrup in the morning.
So why does he smell like pancakes and syrup?
I think his diabetes were so bad. Like he told me his like feet were numb.
Yeah.
I was like, well, that's good, because you're like, your foot's on a rheostat. Yeah. And then he's also like a big no masker. This was before COVID. This was until 2014. and he was like a no masker. So he would see me. He knew the odd days I'd come to the office because this was my second location.
Oh, he'd wear no mask while
mask.
treating patients.
Yeah, no mask ever, unless
Okay.
he knew I was going to come, and gloves 50-50.
Wow.
Yeah, he said gloves got in the way.
Yeah, they ruined the dexterity.
Mm-hmm.
I get it. That's why I raw dog life. just getting other people's saliva all over my fingers
man,
and
what?
their blood and under my fingernails. Like, come on. Like,
You grab a pencil, he'd write in the chart, and so the team said they'd like walk the chart
Just like-
I watched my video, but by the corner dripping by as they're walking down the hallway because he was like, anyways, he was a nice guy.
so you laughed at my raw dogging life comment.
Yeah, raw dogging.
Do you-
Raw
so
dogging.
obviously most of us know what raw dogging really is. Okay. There's this show we've been watching, my wife and I, and it's called Shrinking, Apple TV plug. And this old guy is a shrink, and he goes around using this term like just raw dogging life here. and one of the therapists that also works in there is like, I don't think that means what you think it means. So if you're looking for a good show, Shrinking is probably in the top 5 funniest
really?
shows. Yeah,
That's funny.
Ted Lasso, Shrinking, those are both really comparable shows.
Oh, really?
Yeah.
I like that last one. So back to case acceptance.
Yeah, totally detoured us with the raw dog comment.
Yeah, so I think that's the reason I brought that up is because I do tend to have higher case acceptances, and so when I was 31, 32, I said, well, it's because I look older that patients trust me more.
Yeah.
And that's might be the case. So if you do look young, you can dress like our women dentists tend to look younger typically. So a lot of
because
times
they make better health choices than us.
100%. They're eating healthy stuff. We're down in, well, you had Olive Garden.
Yeah.
So,
Yeah.
just kidding.
Lots of breadstick.
Lots of breadsticks and meat and beef, like
Yeah.
steak for dinner. So for them, they can like dress a little nicer, not just wear scrubs. Or if they do wear scrubs, don't wear like the most trendy scrubs.
Yeah.
Because those tend to make you look younger.
Yeah.
Or wear a white coat. That's what a famous thing the case acceptance guys tell you to do. To
Yeah,
try to
just gives
give
you
you
some
authority.
Yeah.
But I don't think that's it. I think that is it. And if you do look young, you don't have to overcompensate, and you can be more professional and have like really confidence or a lot of confidence talking about different procedures as you're about to
Well,
do.
that's what I was gonna say. Is I think if you were to weigh confidence over looking old enough to do the procedure, I think confidence is more important.
Yeah. I think that's what comes across.
You can overcome so many of your flaws, if you will, that a patient might see with the proper and healthy amount of confidence.
I agree. We had a dentist that used to work for us that we had to let him free, and he was older than all of us. not the other guy I was talking about. He's probably in his late 40s, early 50s. The dentist I was talking before was 70 plus years old, but his case acceptance was by far the least, least or lowest, and he had the age, and he didn't look old. He just was a little older, so he had
Mature.
that for him. He's more mature than us for sure. I probably still looked older than him, and he had the skills. I mean, he's been doing dentistry for over 20 years. And he was always the lowest case acceptance. And because I think it was all about, well, I guess there's two things, but one in particular was his confidence level. It did not shine. And he was always second guessing himself in front of the patient.
Yeah.
It was wild. And it's like, dude, you like, how long have you been doing this? You know the answer. You know what's best in that patient's situation. Like, just recommend it.
Yeah.
And if something changes, it's okay, but it's gonna be like 1% of the time it ever changes. So
Well, and if you're honest with the patient that this may change or that there may be something that needs to change, they're usually cool with it.
yeah, especially if you have the confidence once again, and we'll go to the third thing, that the relationship you built with them is so much more empowering than your age or anything else.
Yeah.
So if you're confident, like this is what we need to do, and you had some time to build that relationship, and something goes wrong, once again you have the confidence to tell them what happened, tell them why it happened, and what you're going to do about it. Almost every time I've built relationships with the patient always says, this always happens to me. No problem. You did nothing wrong. I understand it. And they're way cooler versus if you didn't build that relationship with them.
Yeah. What's the saying? I think you might have said it to me. Patients don't sue people they like.
Yeah, exactly.
Right. And it's not that we want to just make people like us so they don't sue us.
Yeah, we want to
do
practice
good.
malpractice, but like, yeah,
Yeah.
we're nice guys, so
Yeah.
no one sues us.
Yeah, that's the only reason. No.
Otherwise,
No,
we'd be mean.
Yeah. If it wasn't for malpractice, we'd be so mean. No, what I was sorry, what I was gonna say is like building that relationship with your patients is so important. Like, I think that is the most important of the three. Right?
Is there like a class that you can go to that teaches you how to read somebody? Like, because I think it's a skill set that I was more or less blessed with. I don't think I've worked on it at all. And I know when a patient's a funny person.
Yeah.
So I can make inappropriate comments to them and they will laugh. And most of the time, maybe I do that all the time.
I was gonna say, I think you make people your people.
Yeah, that's okay too.
You bully people to be your people.
But then there's patients I go into and it's like really serious. Like I still like building like, hey, where are you from? And like I go, oh, California. I'm like, oh, cool, or whatever. And then there's some people that I can go in and I'm like, oh, how's it going? And I'm, oh, he's not talking today. I'm just going like without just a look or just like one comment. I'm just like,
you can read the body language.
We're going to go work today. Let's just get this done. I won't make my smart aleck remarks. We'll just go after this. You know,
You will in your head though.
I will.
Yeah, you got to have your bit.
Well, no, sometimes.
And then you'll make eye contact with the assistant. Like, I said that joke in my head.
Yeah,
You know
I
it.
said it again. It's 1,000th time again. I think that's. I bet there is. Actually, there is a book. It's about a negotiator who worked for the FBI that would call in to negotiate terrorist or like a hostage situation.
Oh, yeah,
And he
yeah.
talks a lot about it, and he was saying a lot of stuff. I'm like, I don't do any of this. I just kind of get to see a face or a word or how it's said. So that'd be really impactful. I guess what I'm getting at is reading your patient and knowing like, is this one I need to like make laugh? Is this one I need to be serious and professional about? Or is this the one that we can just like get to know each other real deeply and build that relationship that way? I think that'd be super beneficial.
Yeah, I think it is. There's people that are more naturally inclined to read people, and I think it is something that we can improve. There was a show out once that was all about this guy being able to like, he studied people for years and years and years, and he was able to like read their micro movements in their face and like how they slightly slant their eyes this way and that way. And so he like helped out detectives and the police force to like catch
It was
murderers
real
and
life.
stuff. Like,
It wasn't.
I think it was based off of a true story.
Oh, okay. My daughter loves a mystery show where the guy's autistic. The investigator guy.
Okay,
Do you know the show?
you're not talking about the.
So it's at like 10 seasons. It's now off the air, but it's on Netflix or something. Anyway, sorry. I went to another direction I didn't know the answer to. But he's like that, so it's probably not that show because that was all made up. But he's autistic, so he picks up some random weird clues that no one else sees, and he runs with it.
I think I know what you're talking about. I just can't remember the name of the show.
Yeah, Tegan's probably listened to this. She'll tell me.
Yeah.
She's watched them all like 3 or 4 times.
Oh, really?
Yeah, Tegan loves that show. So that's one way to build relationships is learning to read your patient, and that goes with your team members too. But what's your favorite way of building some relationship with that patient? Besides, I think we've talked in the past about like jokes and laughter, but what else do you go after?
I think you and I both like jokes, laughter, and stuff like that. I really do my best to try to take a genuine interest in stuff going on in their own lives. So when we sit down with their patients and they're introduced to us by our assistants, and our assistant says, so-and-so likes to do this, even if I know nothing about it, I'm like, hey, why don't you tell me more about that? That's really cool. I appreciate that all of us have these different hobbies or different career choices out there. I don't know if it happens to you, but still to this day, I meet people that do a job that I didn't even know existed, right? And I'm like, that is so cool so be curious. Being
Not
curious.
judgmental.
Yeah. Not judgmental. But being
That's
curious.
Ted Lasso's quote.
Yeah. He says, if you were curious, you would have known I threw darts for ages like 8 through 15 with my dad at the bar.
That's
and
right. Great
yeah.
clip.
But
I think that's it. Be curious because it is. And I would say there's very few professions that get to see such a variety of backgrounds. Even physicians, if your physician haven't asked what you did, that's like amazing because it's usually such business, like we're in or out. And then two, most people visit their dentist at least once a year, whereas I haven't been a physician for over 3+ years, and that's probably not good. And so we see such an array of backgrounds. It is fun. That could be the game. Like, let me see what occupation I haven't met someone from, or explain or find out something about this patient I didn't know about.
Yeah. And
that extra time you spend with that patient will build that relationship, so they'll trust you that you're doing the right thing because you're likable.
Yeah. I mean, this probably is a bad way of doing it. And when I don't get like a great introduction, or the introduction doesn't take place, or I can't sit in silence for that half second that it takes for the introduction to start,
right.
I'm like, so what do you do for fun when you're not hanging out in the dental chair?
Oh, that's
right?
so dumb.
You want to know what though? It always gets an answer.
It's like, oh, you're dad.
Yeah, dad joke.
That's bad. Good try, buddy.
Yeah.
That's dumb. I like it. I love dumb things.
I was gonna say, I'm pretty sure you do some.
I got worse ones, I'm sure. But then my assistant Belle will call me out and say, "Don't do that." She did that the other day.
Oh,
what I said.
What'd you say?
I always say, "Let's make some memories," or something. Like
yeah,
that.
you have told us about that before.
Yeah. And I do say that. She just doesn't listen to me, Belle. She's my main dental assistant, her and Roman. So, Belle, you don't listen. You're wrong. And I can say that because you're not here, and I'm scared of you.
I hope she listens to this episode and she's like,
I think she's my only team member that does anymore.
She's going to come in and be like, I heard you. You said my name.
Yep, she's going to say that for sure. And I think what do we hit? We hit being likable because you're building trust. You were building authority because you're a little older or you have a white coat on.
Yeah.
What's the other ones that we teach on?
Well, we talked about humor,
Likability.
like being funny.
That's likable.
Yeah.
Authority. That's 2 of the 4. So you feel like you're not selling as much. So you hit on all those. So if you hit on, like we kind of talked about before, you're being likable. You're the authority figure in the room, and you either that's age or with the white coat or a little nicer dress, and you hit every point you can. It sets you up the best for case acceptance. And I think sometimes where all of us dentists lack it a little bit, even if we hit all those points, is then at the end of the conversation, it's that clear communication. Like, okay, Sally, you have 2 cavities on your top right side we need to fix.
Yeah.
This one's bigger. We can fix them at the same time, and that's what I would do. I want to see you here within 2 weeks so this doesn't get worse.
Yeah.
It's going to take me 1 hour to fix both these cavities. And it's very clear, direct. Your hygienist, your dental assistant's listening. And so when she says, oh, he said I could wait for 6 months, it's like a redirect. Actually, he wants to see within 2 weeks before it gets worse. And then it's like, it's very clear, it's overly clear. And then now that front office team or the back office team members now to the front office, hey, Dr. Davis wants to see Sally within 2 weeks. I've already scheduled her for 1 hour for these 2 fillings. This one's worse, but we're going to take them both out at the same time. So it's 3 times, very, very clear what the next step is, what the next, when the timeline is, and how long the time or appointment length is going to be.
Yeah. Yeah. It's telling them where to be or where to start, what to start with, and how long you need, and how long till we start.
Yeah, that's it. I think that if you can overly communicate, which is not even a thing, your case acceptance will go up too. Yeah. So it's more of you not just talking. So you're going to listen to more what the patient wants and give them what they want, and also over communicate what's your next step. And that's going to, if you do those few things, your case acceptance will increase. Yeah. And not only will your case acceptance increase, you will get new patients referred by your existing patients, because they're going to say, like, this guy spent like 2 minutes talking to me. And to them, it might feel like 10 minutes, but it's really like 2 minutes of just getting to know them. They're very clear. The team was exceptional, and you'll just have new patients start rolling in.
Yeah,
it's amazing.
You're a good communicator when you do that.
You're amazing, even if you don't speak English very well, like Dr. Davis.
What do you think about when I go in there and I say a bunch of nerdy dental things like MOD here, DOB here, 3,000, 7,500, or 45123 over there? Do you think patients hear that very well? If you when you're telling them, hey, by the way, you got these MODs on your upper right, your DOs on your lower left, and your quad 6-7s.
Dude,
Right? Obviously, I'm being funny and facetious. I think we can benefit heavily from remembering that we are experts in dental talk
yes, we are.
and our patients are not.
And it's so hard because we want to go to what we're comfortable with. And for a lot of dentists, they're just comfortable with dental language.
Yeah.
And telling them the pros and cons and going into a little more science than we need to. And anytime I have a dentist doing that and I walk by, those eyes of those patients are completely glassed over.
Oh, yeah.
And they're just
glazed
shaking
over.
their head. And they're not listening because they don't understand.
They're confused.
Yeah, it's like you going to go watch Jordan Peterson
Yeah.
live.
Yeah.
Which blows me away. But then falling asleep.
I did.
Because you don't care about Cain and Abel. I mean, you kind of do, but he talks like in such a way that's way over, I think, how we comprehend things.
Yeah.
That we just like zone out and fall asleep.
Yeah.
Even though what he's saying is so amazing and good.
Yeah, he had very great points and
You
facts.
don't know any of them.
And I slept through it all.
Because he's just talking, we're not to the same level.
Yeah.
And so if we can treat our patients if we can come to their level of their dental knowledge,
Yeah.
it really helps. And to go through, like, it's got to be impossible to go through every complication,
Yeah.
right? Like verbally, even written. And if you try, and if you really have this integrity, like you have to tell them everything, then you literally have to tell them everything.
Yeah.
Are you going to tell them like, and sometimes I'll put my band on and a little blood seeps through the matrix band and it affects the margin integrity. And so that filling might only last 2 years instead of 5 years. And I'm sorry that's happened. Are you okay with that? Okay, you're okay with that one? Okay, also, sometimes I have this rough margin, and that rough margin sometimes does irritate the tongue. I can smooth it off if you tell me. Is that okay?
Yeah. You okay with that?
Are you okay with that? Okay. And then sometimes I'll do this filling, and it's a fantastic filling, and then 2 years down the road, you need a root canal. You okay with that? And sometimes the root canal, after the root canal, we got to take the tooth out. Are you okay with that?
Yeah.
And some people do say you get cancer from root canals. Are you okay with that?
Yeah. Yeah.
Like, where's the line stop of you talking about every potential complication,
Yeah.
just to feel like you are keeping integrity and letting the patient know? And it's silly. It doesn't make
Yeah.
sense. You go over the biggest ones, and you talk about the benefits too. Like you say, like there's way more benefits of this than negative things.
Yeah. One of the things I like to do is I like to help cover the risk, complications, failures side of things. I like to tell patients, like, hey, we're going to do everything we can to get the best outcome we can. And we are building in the worst environment ever. It's wet. It's hot sometimes. It's cold sometimes. It's like a jackhammer hitting it all day long. And so sometimes things fail. We'll do everything we can to take care of you moving forward. And if you can trust me with that, I'll take good care of you.
Yeah. And you own it too. And sometimes when a patient pays me for big cases, I feel like almost a weight. I don't feel like it's a relief they chose me.
Yeah.
It's almost like a weight that goes to my shoulders. Like,
Yeah.
buckle up, buddy.
You get to carry
just
this.
marry this patient for a little while.
Yeah.
And it's because if anything goes wrong, because if this procedure goes well, there is no weight.
Yeah.
It's just what I do every day. Well, Monday a week. And it can be, though, quite a burden when things start going wrong. And you got to know, like, you're going to take care of it. And does that mean, do you have the skills to take care of it? Great. Do you have the funds to take care of it if you have to refer out? Then that's fine, too, and don't worry about it. And you just know you got to take care of that patient, and everything's okay. And when you speak with that confidence, patients understand and accept more and more treatment.
Yeah.
That was good.
Yeah, that was good. I like that
Didn't
one.
even talk. I have a funny story to tell you next time, but
Yeah.
it was very funny this time.
Maybe we come in with that story and we just
Come
see
in
where it
hot.
goes. Yeah.
Coming hot. We're going to make it happen.
Coming in hot.
Okay, well,
Coming in, yeah.
I think we're supposed to do this at the beginning of the show, but if you will, share this episode to anyone of your dentist or non-dentists that struggle with sales or case acceptance, and it's going to help them.
Yeah.
And then if not, then reach out. We'll get a coach. We don't coach, but we do know some consultants, coach, that can help you increase your case acceptance, and some guys that you may want to stay away from, and we can tell you that on a one-on-one basis. But
Yeah. Thank you for listening to the dentist
increase
show.
your case acceptance.
You talked over me.
Thanks for listening to The Dentist Show. We hope that this episode helped you make smiles about more than teeth. To get more resources to grow as a dentist and to learn more about Chase and Ryan, go to thedentistshow.com or just follow the link in the show notes. If you enjoyed this episode, share with another dentist in your life and help us grow the movement. And be sure to rate and review wherever you're listening.